Welcome back. So March is Colorectal Cancer Awareness Month, and doctors across the country are seeing a rising trend of colorectal cancer in younger adults. I spoke with colorectal surgeons Dr. Robert Amajoy and Dr. Ben Kulo from St. Luke's Health System. Here's what they're seeing with new patients and the latest advancements in treatments. Well, good morning, Dr. Amajoy. Why are doctors seeing colorectal cancer in younger adults more often?
Blenda, thank you. It is scary. Here at St. Luke's, we are seeing every month anywhere from 2 to 3 colorectal cancers in younger patients between the ages of 30 and 45, and that is a problem. It has been shown that in the United States, persons born in the 1990s have twice the risk of developing colon cancer and 4 times the risk of developing rectal cancer than people born in the 1950s. So we're not eating the right foods anymore. Our colons are seeing way too many processed foods. All you have to do is go to the grocery stores. Behind those glass doors, you'll see over 20,000 products of processed meals. We don't no longer eat as organic as we used to. So because of that, there's a high rise in obesity. And obesity has been shown to be a risk factor for colorectal cancer. Once you have symptoms, any kind of bleeding that is more than 30 days, you ought to have it checked out. You ought to have your doctor see you. Do not take any no for an answer.
And Dr. Kulo, when should people start screenings for colorectal cancer?
You know, we used to think that age 50 was the right time to get started for screening. However, we've looked at the data more recently, the last couple of years, and we've seen more and more a higher trend in younger patients getting colorectal cancer, specifically within the African American community. And so when the American Cancer Society, our society, the American Society of Colorectal Surgeons, has looked at this, we've actually recommended changing the age to age 45. And that's actually now the new national guidelines and national standards, starting for average risk patients at age 45. Patients are average risk if they have no personal history of colon or rectal cancer, and they have no family history of colon or rectal cancer, and even no family history of having colon polyps. So if your dad has had polyps removed on his colonoscopies, you are considered at high risk, and you should start at age 40.
And what are some of the latest advances in colorectal cancer treatment?
Here at St. Luke's, we have all robotic colorectal surgeon experts. We do just about every colorectal cancer robotically. And what that means for you is faster recovery. It means faster return to normal activities, faster return to work. You save at least 2 weeks of recovery.
Additionally, we've found over the years that rectal cancer specifically is best done in a multidisciplinary approach. And what that means is that every single patient who has a rectal cancer that comes to St. Luke's is discussed on a weekly basis at our multidisciplinary meeting. We meet with oncologists, your radiation oncologist, your surgeon, and the radiologist all meet, and they talk about every individual rectal cancer. It turns out that a lot of times each patient has a different treatment plan because of their unique situation.
St. Luke's Health System offers comprehensive care for patients with colorectal cancer. To learn more about treatment options and individualized plans, go to stlukeskc.org.